Hello and welcome, everyone. It's so great to be joined by so many folks from across the country. We are very excited to share some new resources with you today and are very appreciative of the time you are sharing with us. Happy 2024. It is a new year, but we are seeing many of the same themes, and it's going to be a busy time ahead of us. So let's kick off with some quick housekeeping items. Firstly, closed captioning has been enabled and is available to you by clicking the icon on the bottom of your screen. Please note that this session is being recorded and the recording will be posted to CAP's website for those who weren't able to join us today or for anyone who'd like a recap of the resources that we will be detailing for you. Please enter any questions that you may have in the Q&A box at the bottom of your screen. We won't be holding a live Q&A during our session today, but we would love to continue the conversation with you. So please be sure to include your email and we will follow up with you one-on-one to address your question. Please also feel free to reach out to us after the event. We'll be providing our contact information in the chat box for any follow-up questions or comments that you may have. So without further ado, let's get started. My name is Haley Gibbs. I use she, her pronouns, and I'm a senior policy analyst in early childhood policy at the Center for American Progress. As we embark on another round of state legislative sessions, it is more important than ever that we gather state leaders, researchers, and advocates to discuss the ongoing childcare crisis plaguing families across the country. Access to affordable, high-quality early childhood education is essential for children, families, communities, and the broader economy. Early experiences form the foundation of the physical and cognitive architecture that supports children's health and learning potential throughout their lives. The enriching experiences that they have with trusted caregivers in childcare and early learning settings have a positive impact on their health and well-being and help prepare them for school, build foundational social and emotional skills, and ready them for the future. Moreover, childcare is an economic necessity. More than 2/3 of children in the US have all available parents in the workforce, meaning many of these families have to make arrangements for other trusted people to care for their children. But lack of access to affordable care often forces families to make difficult decisions about their work to care for their kids, like cutting back on hours, foregoing promotions to more demanding roles, or leaving the workforce entirely, which can have drastic and lasting impacts, not only on a family's financial security, but also on the businesses and sectors that lose those workers. Nationally, an estimated annual loss of $122 billion in earnings, productivity, and tax revenue is attributed to families' challenges just securing care for an infant or a toddler. Nearly half of communities in the United States qualified as childcare deserts in 2018, and the COVID-19 pandemic had a devastating impact, only worsening those shortages. The critical funds made available through pandemic-era rescue packages, including the American Rescue Plan, were essential to stabilizing the sector and helping to stave off even more closures and greater cuts to the childcare workforce. But as those funds wane, as the first wave of stabilization grants already have, the sector still has yet to recover to its 2020 levels and is left vulnerable, unable to meet the needs of families, educators, or providers. Though increased federal investment is certainly still needed and something that we are continuing to push for, there are some steps that state leaders can and have taken to help improve childcare access and affordability for communities across their state. What we hope this session will offer is not just a reminder of the work that remains to be done, but a high-level overview of two resources that we published at the end of last year that we believe can serve as crucial tools as you embark on your respective legislative sessions and for subsequent research and advocacy efforts. Joining me today are my colleagues Ali Schneider, Anna Lovejoy, and Erin Grant, who will give you more details about each of these products and offer examples for how to navigate them and think through how these tools can complement one another, as well as your respective childcare and early learning policy agendas. With that, I will hand things to Ali to take us through our first product, a comprehensive data dashboard showcasing the state of childcare and early learning across the states. Ali, off to you.
Thank you, Haley, so much for getting us started with that introduction. Hello, everyone. My name is Ali Schneider. I use she, her pronouns, and I'm a policy analyst on the early childhood policy team here at CAP, and also one of the co-authors of the data dashboard and accompanying report that we're featuring today. I'm very excited to give an overview of this first new resource of the day, the Child Care and Early Learning Data Dashboard, which was published in mid-December, but has been updated with a few new features since then, including a few new features and updates that launched as of this morning. At a broad view, the data dashboard is a one-stop interactive page where you can access relevant data points on a number of childcare and early learning topics in each state, the District of Columbia, and at the national level, including on demographics and population characteristics of young children, the cost of childcare, access and supply of childcare, average wages and employment of childcare workers, and more. We include data spanning from 2015 to the present in order to illustrate some key trends over time. The tool includes some variables from CAP's previously published annual state fact sheets, as well as some new variables which help to more comprehensively describe the landscape of childcare and early learning across the United States. We know that data alone cannot tell the full story, which is why we've included an accompanying report, which dives a little more deeply into the information included in the dashboard with narrative discussion and background on the variables and the topics explored. We also intend for the data in the dashboard to be used alongside other tools and resources that help build out the story of childcare and early learning in your state. Because of the schedule of national survey data collection and release, the vast majority of variables are currently only available up to 2022. Variables on Head Start enrollment and access are available for 2023, as is information about current state exclusionary discipline policies and childcare program standards. We are planning for this to be a living resource that we will be able to periodically update to expand functionalities and to reflect new information as it becomes available. So that's something that we're looking forward to in the future. Our team already has some ideas for what we want to add, though we do welcome input from you all as you begin to explore and use these tools. I'm going to go ahead and share my screen to walk through the dashboard, so just give me one moment to pull that up. Okay, so the dashboard will initially load to the 2022 national level page, which is what you're seeing right now. But you can access other years in this drop-down menu dating back to 2015. The state pages can be accessed below on the feature that says Explore State Data. And let's see, there's also an option to view the map on the Explore the Map feature here. I'm going to start on the national level page, but I'll navigate to other views in just a moment. The dashboard variables are organized into 7 overarching categories, 5 of which are available on this current view. The remaining 2 categories, the remaining 2 categories will be available on the 2023 state page view. I also want to draw your attention to the 2023 accompanying report, which is linked here. And that includes some additional background information and narrative context on the indicators, key national level trends, and additional figures and graphics, which help to contextualize the data included here. The report is organized by the same 7 overarching categories for consistent structure and for ease of access. Each of the categories in the dashboard includes a set of variables which were mostly calculated using large publicly available data sets, such as the American Community Survey and Bureau of Labor Statistics surveys. You can access information on the source and methodology by hovering over the numbered citations here. You can also scroll down to the bottom of the page and access endnotes here. For those interested, more information on methodology can also be found in the codebook, which is linked directly in the accompanying report that we mentioned here. You'll see that many variables here also include a small line chart, which illustrates trends over time, and it also helps show the years for which each indicator is available. The charts include a dot for years that are available, and you can hover over the chart itself to see those values reflected. Just to give you an overview of what is included in each of the categories, I'm going to walk through each section. So first, we have the demographics and overview category, which includes some information on population characteristics of young children and families with young children. This includes population numbers of young children, including the number of infants and toddlers, and the number of preschool-aged children at the national level and in each state. This also includes some factors such as as poverty estimates for the under age 6 population, and the number and percentage of children under age 6 with all available parents in the workforce, and the number of parents reporting job changes due to problems with childcare. On the national page, these data demonstrate that early childhood poverty has declined over the years but remains high. Early childhood poverty using the supplemental poverty measure, a measure which takes into account additional considerations compared to the official poverty measure, such as government benefits, taxes, and cost adjusted for geographic differences, declined in 2021, but more than doubled in 2022 following the expiration of the ARPA extended child tax credit. We also see that over 2/3 of children under age 6 have all available parents in the workforce, with more than 2.6 million parents reporting needing to make job changes due to issues with childcare. I'll mention that these topics are all explored in a little more depth in the accompanying report, with additional data on the racial and ethnic demographics of young children in the US compared to the overall population. Turning over to the cost of childcare section, this category includes some price estimates for center and family-based care, as well as the estimated percentage of qualifying low-income children under age 6 who receive childcare subsidies. Here we see that the average price of childcare, already high in 2015, has only increased over time at a rate that outpaces inflation. Infant and toddler care remains especially high. While subsidies help many low-income families offset childcare expenses, they fall far short of the need and do not sustainably cover the true cost of providing high-quality care. Only a fraction of eligible children, less than 15%, in fact, actually receive subsidies. Moving over to the workforce section of the dashboard, this section includes some information describing average wages and employment numbers for childcare workers. One trend to note is that median hourly wages for both childcare workers and preschool teachers have remained far too low and relatively stagnant across years. The accompanying report provides some additional context on the demographics of the childcare workforce, inflation-adjusted wages, and a chart of monthly employment numbers. I will actually just navigate over to that report now to give you a quick look at the additional figures that are included there. So you can use this chapter section to go down to the different sections, and under the workforce section, this additional chart displays the unadjusted versus inflation-adjusted median hourly wages for childcare workers and preschool teachers. Looking at inflation-adjusted wages, between 2015 and 2022, wages for childcare workers increased less than $2, and for preschool workers, this was only 10 cents. Scrolling down, with this additional chart demonstrates the monthly total number of employees in childcare services, which have yet to recover from back to pre-pandemic levels, even while job postings in the sector remain high. The childcare access category includes some information on state or public preschool access, as well as the percentage of the population living in a childcare desert. A quick note that CAP's childcare deserts estimate is currently only reflective of the 2018 landscape of childcare supply, but for now we are continuing to highlight that previous analysis with the caveat that the childcare deserts have only become more severe in many areas due to the COVID-19 pandemic, expiration of federal stabilization dollars, and continued lack of sufficient federal investment in the childcare sector. Even before the pandemic, over half of the US population was estimated to be living in a childcare desert, with disproportionate impacts felt by low-income communities, Hispanic or Latino communities, and other communities of color. Families of infants and toddlers and children with disabilities also often face particular barriers in accessing care. Finally, the Head Start programs category, which I'll navigate back to 2023 to see, includes some statistics on enrollment and program access rates for Head Start and early Head Start programs. Again, I would recommend viewing the figures in the accompanying report for some more detailed information and charts and discussion. Overall, though, these data are showing that fewer children and a lower percentage of children in poverty are accessing Head Start programs compared to before the pandemic. Unfortunately, difficulties with recruiting and retaining childcare workers, driven by low compensation, benefits, and job quality, continues to be a limiting factor in the number of children that Head Start programs are able to serve. I'm now going to navigate over to the state page section. So if you scroll down to the bottom here, you can find a drop-down menu. I'm going to go ahead and select Georgia just because that is my home state. And it'll take a moment to load here. But you'll find that the state pages have a very similar structure to the national page, and will also load to the 2022 view because the vast majority of variables are only available up to 2022. By selecting 2023, you will be able to view those additional two categories I mentioned, which represent currently in state policies and standards. Looking at the exclusionary discipline category, this includes some descriptive information on whether each state has a policy aimed at reducing and or eliminating exclusionary discipline in early care and education settings, and if so, the information on the type and details of that policy. This data is based on a 2020 survey from the Build Initiative, but includes new and updated information from our research and phone and email contact with state administrators. The report itself includes a deeper dive into the harms of exclusionary discipline practices in early care and education settings, the disproportionate impact on Black boys and children with disabilities, and the varied ways that states are beginning to address this issue through policymaking. Finally, small child-teacher ratios and group sizes are essential in early care and education settings, not only to improve child health and safety, but also to improve the quality of caregiving and to increase interactions between children and their caregivers. The Child Care and Development Fund program requires states to describe their established standards for child-teacher ratios and group sizes in their CCDF plans, which are submitted every 3 years. While no national benchmarks exist for health and safety standards, the early Head Start and Head Start standards can be used as a benchmark to these programs that promote high quality early childhood care and learning, and optimize individual interactions between children and their caregivers. This category includes 4 different indicators on whether state standards for maximum group size and adult-child ratios as described in these plans meets or exceeds benchmarks at a number of different age groups. Finally, the dashboard also includes a map view, which I am navigating to here. And this displays the national distribution of several of the indicators in the dashboard across the United States. We have opted against including certain variables which vary widely based on state population size, but by navigating to the drop-down menu here, you will be able to see the options of variables that you can navigate to, as well as the state views. I want to make sure we have enough time to walk through the other resource that we're featuring today and to discuss some examples of how the tools can be used in collaboration with one another. That being said, I hope this overview and walkthrough gives you a better idea of how to access and tailor these data for your advocacy, policymaking, and research needs. Please don't hesitate to reach out to me or the team if you have any specific questions about this tool or how to use the data in your state. As we think about updates going forward, we also welcome input or thoughts on how you're using this information and what else you would like to see included in the tool. I will now pass this over to Anna to give us an overview of the second resource of today, the State Policymaker Toolkit. Take it away, Anna.
Thanks so much, Allie, and Happy New Year, everyone. My name is Anna Lovejoy. My pronouns are she, her, and I'm the Director of State Policy for the Early Childhood team at CAP. Over the past few years, the childcare industry has seen an unprecedented infusion of federal funding in response to the COVID-19 pandemic and its sector-wide ramifications for families, providers, and educators. Specifically, the American Rescue Plan allocated $24 billion in emergency funding to help childcare providers keep operating, but the stabilization grants included in that funding expired at the end of September 2023, and experts are predicting a wave of tuition increases and possible closures of childcare programs without further public investment to prop up the still vulnerable industry. Congress has failed to pass any significant funding increases for childcare, so it is up to the states to address the burgeoning childcare crisis. The Center for American Progress has published a toolkit to help guide state policymakers in their efforts to increase investments in childcare and early learning. The toolkit provides information and resources to help policymakers advocate for increased investments in their state's early childhood system, garner broad advocacy, and ensure that those dollars are smartly invested to help stabilize providers, invest in the early care and education workforce, and bring down costs for families. In addition to including examples of policies that support state childcare and early learning, the toolkit provides messaging guidance and talking points to help policymakers and advocates elevate the need for early childhood policies. It also suggests communication strategies and sample messaging to ensure that discussion of childcare and early learning permeates state and local policy discussions and reaches constituents and on-the-ground activists. This toolkit is an update to CAP's 2019 Early Childhood Toolkit for State Policymakers, and it includes new data and policy options drawn in part from previously published CAP resources. It is organized into 3 chapters. The first is how to expand access to high-quality childcare and preschool. Then we have messaging and communications to promote early childhood education. And finally, the related resources on childcare and early learning section. The toolkit is available as an online resource as well as a downloadable PDF. Before I review the types of policies included in the toolkit, I want to remind everyone that state leaders can use innumerable strategies to address the needs of children and families in their districts. What this toolkit offers is not an exhaustive list, but rather a sample of evidence-based solutions and a selection of examples from states across the country to illustrate the options available. While it will often be necessary for policymakers to focus on specific areas of this issue, they should ultimately be working toward the goal of a comprehensive early childhood system that supports healthy children and families and prepares children for kindergarten and beyond, that meets family needs by enabling them the freedom of choice regarding care arrangements for their children, that eases the financial burden of accessing high-quality care, and that provides sufficient and stable funding to the sector that supports providers and educators. The toolkit recommends the following policy strategies to build a comprehensive early care and learning system. Each strategy includes multiple sub-strategies and state examples to illustrate these strategies in action. They include improving the current childcare subsidy system to increase reimbursements to providers and help reach more eligible families in need of financial support, targeting support to high-need areas and populations, including reducing childcare deserts and increasing care for infants and toddlers, investing in the early care and education workforce to provide dignified wages and benefits that help recruit and retain these crucial workers, implementing a mixed delivery universal preschool program that is inclusive of many types of care and gives parents a range of options that suit their needs, eliminating preschool suspensions and expulsions to help mitigate bias in early childhood settings and ensure every child has access to these crucial foundational early learning opportunities, supporting the needs of young dual language learners, and expanding early Head Start and increasing support for infants and toddlers. The toolkit also includes details about how policymakers can increase the availability of and access to robust data on early childhood issues, as well as strategies to generate revenue to fund policy priorities that support young children and their families. The messaging and communication section of the toolkit provides recommendations and guidance on how to make the case for investments in childcare and early learning in states. It offers data and talking points that policymakers can use to bolster their arguments and inform decision-making at the state level. It also offers guidance on how to tell a story and make a case, and includes sample social media posts and an op-ed that policymakers can adapt with their own state-level data to get the word out about the importance of early childhood investments. This is where using CAP's 50 state data dashboard will come in handy to identify state-specific data points to make your arguments. And please note that this resource will be updated with new data and additional functionalities in the coming weeks and months. The final section of the toolkit offers a list of resources that can help make the case for investments in childcare and early learning at the state level. As you can see, it provides links to CAP-produced work on childcare and early learning, CAP interactive and online resources, policy resources from other organizations, and additional data resources from CAP and elsewhere. This is not an exhaustive list of resources available, but the list has been curated to include those that speak more directly to state-level policy and data for use by state policymakers. We're very excited to share the State Policymaker Toolkit with you and hope this will be a useful and helpful tool as you work through your respective legislative sessions and think about how to engage your community leaders, researchers, and advocates in the months to come. I'm happy to answer any questions that you may have on this resource and hope you will consider me a continued resource and partner. With that, I'll hand things over to Haley and Aaron to dig further into how the data dashboard and toolkit can be used together to help advance a progressive childcare and early learning agenda. Haley?
Thank you so much, Ali and Anna, for such great overviews of those resources. I hope what we have illustrated for you all is how rich and comprehensive of tools the data dashboard and the policymaker toolkit are, and what utility they may have for you as a legislator, researcher, or advocate in informing a robust childcare agenda, both for 2024 and in subsequent years as we continue the momentum toward a comprehensive, equitable childcare system. As a state leader, perhaps a more feasible place to start often is to advance policy solutions that maximize the potential of the existing subsidy system. States have a good degree of flexibility in how they implement policies around the subsidy system and can take actions to help promote access and stability. This can look like investing the resources necessary to increase eligibility thresholds and reduce enrollment barriers so that the families who depend on the program can access services, while also increasing reimbursements to providers to ensure that they have the slots available to meet families' needs. Adopting reimbursement models that reflect the true cost of care, such as cost estimation models, and tying reimbursements to enrollment rather than attendance are two such levers for ensuring that providers have the support that they need to supply the existing and growing demand for care. Just this week, for example, Massachusetts announced that it's one of the first 6 states in the country, joining New Mexico and the District of Columbia, among others, to adopt an alternative methodology for establishing provider payment rates that accounts for the true cost of providing high-quality care. Policymakers can also ensure that they are targeting support to high-need areas and populations, mitigating the impact of childcare deserts, and ensuring that families living in rural areas, those who have infants or toddlers or children with disabilities, who work non-traditional hours, or who come from dual language households, also have the choice of care arrangement that works best for them. North Dakota, for example, passed legislation increasing reimbursement rates for providers serving infants and toddlers. Both Tennessee and New York have targeted efforts to build supply in areas designated as childcare deserts. Illinois and New Jersey have taken steps to advance access to childcare services for dual language learners, and Texas requires dual language bilingual education programs for students beginning in preschool. Key to supporting any sustainable model for care is the childcare workforce. Providers can't sustain the slots necessary to meet local demand if they don't have the teachers to staff those classrooms. And providers can't attract a qualified workforce without the compensation, benefits, and quality work environments that this critical workforce needs in order to support their own families. A childcare workforce that operates below capacity affects the overall economy. And the childcare sector, unlike most other private sector jobs and non-farm employment, still has not recovered to its pre-pandemic levels. Lawmakers can pursue policies that target the needs of the childcare workforce by, for example, establishing worker boards, creating wage enhancement initiatives such as employment benefits, scholarship programs, wage supplements, and if one does not already exist in your state, creating a workforce registry that helps to collect and track data around your state's early care and education workforce and help build out professional development systems. 23 states and the District of Columbia, for instance, have adopted the Teach Early Education program, or Early Childhood program, excuse me, which provides scholarships and engages state leaders to support early educators' access to higher education, promoting increased compensation, and helping to institute greater job stability. This is obviously not an exhaustive list of policy actions or strategies, nor is it a full list of state examples where these great innovations are taking place. But we hope that the recommendations that we provide in the toolkit, combined with available data from the dashboard, can help you craft a well-rounded policy agenda and bring together a well-researched case for childcare using the data that we've provided here. To illustrate a few more examples, I will now pass things to our colleague, Erin Grant. Erin, take it away.
Thanks so much, Haley, and thank you to Anna and Allie for running through those two resources. I'm Erin Grant. I use she, her pronouns, and I'm a policy and outreach specialist on the early childhood team. As you've seen already, both the data dashboard and the toolkit provide rich data and examples of effective, holistic early childhood policies. As the federal appropriations process continues, and most states are in the thick of 2024 legislative sessions, combining data from the dashboard and strategies from the toolkit can build a strong case for investing in childcare and early learning in your state. To illustrate this, let's look at our first example, North Carolina. Let's take a look at the childcare and early learning landscape in North Carolina in the data dashboard. I know we had a question on how to navigate to state pages, so Allie is demonstrating this now. As you can see in the dashboard, more than 2/3 of children under age 6 in North Carolina have all available parents in the workforce. Moreover, over 18% of children under age 6 in North Carolina live in poverty as measured by the official poverty measure, a rate slightly higher than the national average of around 16%. Navigating to the workforce category, we can see that the median hourly wage of childcare workers in North Carolina is $12.87. Which amounts to approximately $26,700 annually for a full-time childcare worker. As a point of reference, the living income standard in North Carolina, or the estimated amount needed for one adult and one child to meet basic needs, was $38,488 in 2019. These data demonstrate a few areas in which North Carolina has an opportunity to further invest in childcare and early learning systems in their state, including by supporting the childcare workforce and ensuring that they are targeting vulnerable families often priced out of high-quality care. This includes the steps that North Carolina has already taken to recruit and retain early learning educators through their wages program, adopting a wage scale plan that includes educators in all settings, and also expanding access to dual language early learning programs. In addition, just last year, North Carolina passed legislation to increase the recruitment and retention of childcare workers through a new Child Development Associate credential. These data are key to making the case for improving these aspects of the childcare and early learning systems in North Carolina and across the country. With these figures, advocates and state policymakers are better able to make the case for investing in childcare and early learning. Let's now take a look at the Toolkits chapter on messaging and communications. Here, you'll find a wealth of useful talking points and strategies to use these data to tell the story of childcare in your state. One of the most simple and effective ways to advocate for childcare and early learning is by educating those that may not be familiar with the landscape. Take a look at these social media examples in the toolkit. Using the hourly wage for childcare workers in North Carolina that we pulled earlier from the data dashboard, we can bring attention to this issue and stay on messaging. The average childcare worker in North Carolina makes only $12.87 an hour. It's time to raise wages for the dedicated workers taking care of our children. Using social media to highlight key data about childcare in your state has a dual purpose. One, it will increase awareness of the issues the childcare and early learning sector faces, And two, it establishes a messaging campaign that other advocates can join in on and harness the power of a collective voice. Using other similar messaging tools from the toolkit, such as a sample op-ed, and citing data that we provide you in the dashboard can help hone that voice and ensure that you are making a strong and well-researched case for expanding access to childcare. I want to take another state as an example. Let's look at Nevada. As you can see, Nevada loads to 2022. Let's explore the cost of care indicator. As you can see in this indicator, the average annual childcare tuition for a 4-year-old in center-based care in Nevada is slightly higher than the national average of $10,472. While these data are extremely helpful in making comparisons across states and at the national level, it's also crucial to understand how these unaffordable costs are really affecting families in your state. Let's go back to the toolkit. A key component of an effective advocacy campaign is combining data with the personal stories and lived experiences of families facing the childcare crisis head-on. Consider some of these questions posed here to start the conversation with parents and families in your community, and use this to paint a fuller picture of the childcare landscape in your advocacy efforts, using questions such as, have you or someone you know faced barriers to accessing affordable, high-quality childcare? Did you or someone you know take time out of the workforce or leave the workforce entirely to care for children because of the high cost of childcare? Or have you or someone you know had to consider relocating to a new community or state that is not a childcare desert? The questions provided here in the toolkit can serve as a jumping-off point for advocates and state policymakers hoping to become more familiar with the challenges facing parents and families in their communities. Now that we've discussed a few ways in which advocates can draw attention to the childcare and early learning system and make the case for increased investments, let's explore how state legislators have and can implement these changes. The toolkit features several policy recommendations, which illustrate various policy levers at your disposal as state policymakers to increase access to childcare, improve early childhood educator pay, and better support infants, toddlers, and young children. Current childcare subsidies reach only a fraction of eligible children across the country. Let's take a look at the interactive map featured in the data dashboard that Ali highlighted earlier. Using the indicator for percentage of qualifying low-income children under age 6 who receive childcare subsidies, you can see the data displayed as is most recently available from 2020. As you can see, many children who should have access to subsidized childcare do not receive it. While it is critical that children who should be receiving subsidized care do have access to it, it's also important to expand the overall access to high-quality childcare across the country. Per the toolkit, one way in which states can accomplish this is by making changes to income requirements to increase the reach of existing childcare subsidy programs. The toolkit explores several states that have already taken steps to increase childcare access by expanding income eligibility requirements for childcare assistance. For one, Vermont recently passed legislation that invests $125 million annually into their childcare system, which will allow Vermont to increase access to its childcare assistance programs for families earning up to 575% of the federal poverty level. The toolkit also highlights Minnesota, which invested $750 million in new funding for childcare and early learning programs, including funds to increase eligibility for their state childcare assistant program. Vermont and Minnesota are only two examples of many states that are taking action to increase access to childcare. The toolkit explores how other states are improving access to childcare as well. As you can see on the map, 9.6% of eligible children in Minnesota received childcare subsidies in 2020. While 13.2% of eligible children received subsidized childcare in Vermont in the same year. It is our hope that we will continue to see state legislation increase access to childcare, and we look forward to seeing these changes reflected in the data dashboard in updates in years to come. Let's explore one more indicator on the map. You have a lot of options to choose from. If we're looking at median hourly wages of childcare workers, you can see that the range of median hourly wages for childcare workers across the country, with darker red reflecting a higher salary relative to lighter red. Let's now jump to the most recently available data on median hourly wages, which is for 2022. Many states have made progress in increasing the median hourly wage of childcare workers between 2020 and 2022, as you can see on the map, though there is still a lot of work to be done. As illustrated in the toolkit, increasing wages and benefits for childcare workers can support recruitment and retention efforts, fairly compensate the skilled work of early childhood educators, and stabilize significant turnover among early childhood programs. Many states have made strides toward paying early childhood educators and childcare workers what they deserve, including through North Carolina's wages program that I mentioned earlier. In the District of Columbia, the Early Childhood Educator Pay Equity Fund provides bonuses of $10,000 to $14,000 to early childhood educators. Using a different approach, Louisiana's school readiness tax credits provide a refundable tax credit to early childhood educators if they work at least 6 months for a licensed provider who participates in the state quality improvement system. Exploring the toolkit will provide you with examples of opportunities for your state to increase compensation for early childhood educators and childcare workers. Again, we hope to see the data dashboard reflect a trend of increasing median hourly pay as new initiatives are implemented and other states take similar steps toward adequately compensating early childhood educators and childcare workers. These states and examples illustrate a small range of policy and advocacy options provided to you through the toolkit, but there is ample data for each state to draw from in the dashboard. We hope this exercise was useful to give you a small glimpse into the possibilities for building out a state story for childcare investments in your state. As legislative sessions unfold and the 2024 elections near, we know that advocacy and outreach efforts will be at the forefront of your minds as they are ours. As the legislative landscape continues to evolve, we're excited to roll out additional updates and visualization features to the data dashboard that will provide even more opportunities for state policymakers and advocates to use the data dashboard and the toolkit as resources in your work. As a reminder, we're not planning to hold a live Q&A, but we would love to continue the conversation about these issues and broader priorities around childcare and early learning. I know we've seen some questions in the chat already. It would be great if you could provide us with your email, and we'd love to connect one-on-one to address these questions and any others you may have about the dashboard, the toolkit, or childcare policy priorities that you're thinking about for 2024. We really hope that both of these tools and this webinar help you feel better prepared to do the important work of advocating for children, families, and childcare workers. Again, we'll follow up with a recording of this webinar and additional resources, including those that we mentioned today. We hope that you reach out with any questions, and again, please provide your email to us in the Q&A box. Our emails will be shared in the chat if you'd like to reach out to any of us individually. And with that, thank you so much for joining us. We look forward to responding to your questions, and we hope you enjoy the rest of your Thursday.